Today's nursing mindset is about perfusion. When many students hear the word perfusion, they immediately think about heart rate, blood pressure, or pulse. Now, those are all important, but perfusion is much bigger than a number on a monitor. The question nurses really are asking is enough oxygenated blood reaching the tissues that need it? Everything on this graphic helps answer that one question. Let's start in the center. Perfusion is the delivery of oxygenated blood to the body's tissues and organs. Every cell depends on that oxygen to survive. Without adequate perfusion, tissues begin to lose oxygen, organs cannot function normally, and if the problem continues, cells will die. So how does perfusion actually happen? It starts with the heart. When the heart contracts, it pumps oxygen-rich blood into the arteries. As that blood moves through the arteries, it creates a pressure wave. That pressure wave is what we feel when we assess a patient's pulse. The pulse itself isn't the blood, it's the wave created as blood is pushed through the arterial system. As blood continues traveling through the circulation, oxygen and nutrients are delivered to tissues and organs. Those organs use oxygen to function normally. Finally, individual cells use that oxygen to produce the energy they need to survive. Notice that every step depends on the one before it. If blood isn't being pumped, oxygen isn't delivered. If oxygen isn't delivered, cells can't function. That's why perfusion is such a foundational nursing concept. Now think about the assessments you perform every day. When you count a pulse, you're not simply counting beats, you're asking, is the heart pumping effectively? When you measure blood pressure, you're not just documenting two numbers, you're asking, is there enough pressure to move oxygenated blood throughout the body? Even when you compare pulses on both sides of the body, assess pulse strength, or evaluate rhythm, you're gathering clues about perfusion. Vital signs are not the goal, they are the clues. The graphic also reminds us that many factors influence perfusion. Blood pressure changes based on cardiac output, blood vessel resistance, blood volume, blood viscosity, and arterial elasticity. Heart rate changes with exercise, pain, fever, medications, stress, and many other conditions. As nurses, we don't simply memorize these factors. We use them to explain why a patient's assessment findings make sense. Finally, think about your nursing interventions. When you encourage fluids, help a patient change position slowly, monitor vital sign trends, or educate a patient about smoking cessation and exercise. You're doing more than completing tasks. You're helping improve perfusion and protect the organs that depend on an adequate blood supply. So the next time you assess a patient, don't stop after documenting the heart rate or the blood pressure. Instead, ask yourself, is oxygen reaching the tissues? That one question will guide your assessment, your clinical judgment, and your nursing interventions. Remember, numbers tell you what is happening. Your nursing mindset helps you understand why it's happening and what to do next. Every safe nursing decision begins with the right mindset. Remember, every safe nursing decision begins with the right mindset. So keep developing your nursing mindset, and I'll be back soon with another nursing mindset video.